Good afternoon, everyone. It is my great pleasure to introduce Dr. Heather Sanderson. Heather is the founder of Solsere Health Clinic and Marama. Marama is the first of its kind residential care facility for the elderly. Her team of doctors and health coaches focus primarily on supporting patients looking to optimize cognitive function and prevent chronic illness. She has been awarded a grant to study her individualized, integrative approach to reversing dementia. At Marama, she has created an immersive residential experience in the lifestyle proven to best support brain health. She is also the host of Reverse Alzheimer's Summit, where she interviews brain health experts and works to share what is possible for those suffering from dementia.
Thanks, Dad. So I'm Heather Sanderson, and I feel really privileged to be here with you all today because it's an absolute luxury to be talking to people who don't have dementia. I believe that Alzheimer's is optional at this stage. I have seen it reversed too many times to know that we can all, most of us, the vast majority of us can avoid going down that path. And so the ability to talk to a group of people who is well educated, still working, that is not yet suffering with dementia is just, like I said, an absolute luxury and a privilege. So how do we prevent dementia? It really is the same approach as reversing it. And it's a more compelling story, I think, when we can show that we have reversed it. It makes it a little easier to buy into the story that, wow, if we can turn this chronic and what was supposed to be an irreversible disease around, then maybe we don't have to be so terrified of it. And when we start noticing those small cognitive changes, things like misplacing keys or phones more often, or not being able to remember a name or a place that you could have 10 years ago, when those small changes start to happen, when you don't feel quite as sharp, that is the moment to take action. And so what I'd like to do today is introduce you to what that action would look like, what you can start doing right now. You don't have to wait to be in your 60s, 70s, 80s to do the things that are really great for brain health. These things actually can start in childhood, they could start in utero, and this is really a brain healthy lifestyle that I'll be discussing today. So what you see here on the screen is the Montreal Cognitive Assessment. And I'm introducing this for a couple of reasons. One, I refer back to it because it's one of the ways that we test how well we're doing, both in my clinic at Solsere and also over at Marama. We test MOCAs regularly on our patients and residents. And you may have seen this in your doctor's office because it's a very commonly used screening tool for cognitive decline. And it's basically a worksheet. It takes about 15 minutes for a trained tech to give this to someone to talk them through it. And what we want, it's out of a 30-point scale. You can see that down at the bottom. So out of 30, 30 is perfect. And it means that you don't really have cognitive decline that's measurable yet. However, for a group of attorneys like you probably would have a 30 out of 30, even if you're starting to experience changes. So this is a clinical screening tool. It's not the best tool, but it's a quick, easy, free tool that you could ask your doctor to give you. And it's something that we use routinely. Anything over 26 is normal, is quote unquote normal for people with graduate degrees. You really want to be at 30 and probably use a more precise or more sensitive tool. But if you have a loved one who's maybe suffering with cognitive decline, somebody that's older or a family member, you might start to hear about MOCA scores. So below 26, at 25 and below is measurable cognitive decline. And then when you start to get into the teens, it's starting to affect activities of daily living. And when we get to 1 and 2 and 0, this is when people are starting to lose verbal ability. So my very first patient that I saw, her name was Linda, and she came in with a baseline MOCA of 2 out of 30. So again, this is pretty much almost nonverbal. She could say yes and no. You can see she could still draw a circle. but her handwriting had been affected. She couldn't remember a question long enough to answer it. So I would say, what did you have for dinner last night? You could see the wheels spinning in her head and she understood the question, but by the time she went to answer, she couldn't find the words and couldn't remember the question. And just 6 weeks later, she came back and her MoCA score was now a 7. And you can see visually, she's starting to connect the square. It's not perfect. This woman is not going back to work, but you can see that we're now oriented in the right direction. Her neurons are functioning better than they were 6 weeks previous. She's adding numbers to the clock. This is supposed to be an irreversible disease. People are only supposed to go in one direction. And I'm here to tell you, I've seen over and over and over that this is absolutely reversible for most people. It takes hard work. And it's much, much easier to reverse cognitive decline at those earliest stages when people are younger. And so my plea to everyone is to do these things right away at the first sign, or even before you start noticing this. Part of the reason why is because there is this silent preclinical phase, and cognitive decline as you progress through cognitive decline, that hill gets steeper and steeper down. And so this preclinical phase can sometimes last for decades, 20 years, 30 years. And this is really where we want to be intervening. And then there's this term that's used, mild cognitive impairment. This will show up on a MoCA. So you'll be able to measure mild cognitive impairment. And this tends to concern the patient more than doctors, because there isn't a lot that conventional medicine can do at this stage. This is when people, again, stop remembering the names of maybe neighbors, as not people that they see every day, not family members, but kind of more distant cousins or neighbors, or things that they used to be able to math, they used to be able to do easily, or things they used to keep track of start to feel more overwhelming. But it's more of a subjective experience, and we can start to measure it. This is called mild cognitive impairment in the conventional world. And I would argue that this should be called stage 3 dementia. The nomenclature really doesn't emphasize how serious this is. If we are starting to measure cognitive decline, this has been going on for a long time. And I would argue that we need to take action immediately, because as people progress towards dementia, more severe dementia, although we see miracles like what we saw with my first patient, Linda, that is not the norm. Most people, once that snowball is starting to accumulate and you're rolling downhill, it's hard to turn that around. And so I would propose changes to the nomenclature, and I'm going to emphasize this again, because I think it's so important to be changing the language and the narrative around this. Too many people at this point are told, when they see even a well-meaning and well-educated neurologist, that there's nothing that you can do, when in fact it's almost overwhelming how much you can do to reverse cognitive decline. So this pre-symptomatic change, you can sometimes see on a PET scan, and you can sometimes pick up beta amyloid plaques or tau proteins in spinal fluid, but this is before somebody has any symptoms. This is actually the best time to start treating, especially if someone has known ApoE status or APP status, some genetic predisposition. If there's a strong family history, you want to be taking action before there's any sort of subjective change. So then subjective cognitive impairment, again, can last decades, about 10 years. And this is relatively easy to reverse. So when I have people starting to say, like, oh, I used to remember that, this didn't used to feel so hard, that's the time to do something about it. And this is, sadly, it's heartbreaking to me, this is rarely when people do intervene, because they've been told for so long that there's nothing you can do. And so people will start to hide it or start coping. They become embarrassed, and they avoid getting help, when really this is when we can do the most. And then in my clinical trial, we recruited everyone below this, so both mild cognitive impairment and the final stage Alzheimer's or later stage Alzheimer's, we recruited into our clinical trial. So they had measurable cognitive decline. And again, I believe that this mild cognitive impairment, that's almost like saying mild cancer. Like it's just, there's nothing mild about it. This is relatively late in the pathophysiological process, so there's changes that are measurable and obvious in the brain, and also obviously showing up and affecting people's activities of daily living. And then once we get to these later stage Alzheimer's, the process has been going on for a very, very long time, and this is just absolute torture. My life's work is helping people avoid that stage. Dementia is a complex chronic disease, right? What we've seen in the literature and what we've seen for decades in the dementia space, and especially in the research, is this attachment to the beta amyloid plaque hypothesis that there's going to be one pill that someone can take that will reverse this and people will get their brains back. And unfortunately, that's not how this works. And the research kind of pyramid of the gold standard in research is this one pill, one variable in a double-blinded placebo-controlled trial. And when we're talking about complex chronic disease, the complexity of that research paradigm does not match the complexity of the disease. And so when we start to think about complex system science and how we apply that to the complex system that is the human brain and body, we really need to upgrade there needs to be a paradigm shift in terms of how we think about solving these diseases. And one of the kind of through lines here is balance, that we need enough, not too much. We need it in the right place, whether it's a nutrient or a toxin, it needs to be in the right place, whether it's a hormone, we need it at the right time, right? If you have cortisol way high at night and melatonin high in the morning, your circadian rhythm is off. So do we have the right amounts in the right place at the right time? And when I am asking that question, I'm primarily thinking about the neurons, but really we're thinking about every cell in the human body and how we can optimize function. And so this approach that we take to the complex chronic disease that is dementia really can be applied to any complex chronic disease. We see it in the neurodegenerative space, and we're learning more certainly about Parkinson's, about ALS, about MS, and then of course also autoimmune conditions, diabetes, heart disease. These all fit in this category of complex chronic disease where conventional medicine is really missing the boat, and we're not applying the right paradigm to the complexity of these problems. So when I think about foundations of brain health, I'm going to take us through each of these sections and talk a little bit about them so that you can hopefully take away some things that you could implement today at home. So toxicity is, again, it's balance. So a little bit of toxicity happens. Each one of our cells creates some metabolic toxicity. We need to be able to get rid of that. And so making sure that there's not too much coming into the system, and that what does come in, we're able to get rid of. Nutrients, there are diseases like scurvy, where if you don't have enough vitamin C, your teeth fall out. And then there's also, there are diseases of just having a functionally low, like B12 level or vitamin D level, where you don't have enough for cells to really optimally function. And that's what we're looking for. We're looking for that optimization, not just the absence of disease in this case. So balance has a little bit tighter window. And then structure and blood flow, we'll go into a bit. With structure, we're talking about molecular structure at the genetic level. We're also talking about airway, and of course, the blood. Can you get blood to your brain? Can you get blood out of your brain? And so we'll talk a bit about strategies there. Stress levels. If we're just couch potatoes sitting around, we're not getting any stress. We're not getting any exercise, any stress on those muscles. If we're not getting any stimulation, that can be an issue. That's too little stress. Now, if we have too much, that can also create toxicity of stress hormones in the brain. So finding that balance and maintaining that balance is essential to cognitive function. Infections, particularly certain infections, can lead to inflammation in the brain. And then hormones also send signals that are associated with youth and with creating new memories, right? This makes sense. We go to college in our 20s when hormones are at their highest. So toxicity, diving into this, I think of them in sort of three flavors: mycotoxins, and we can measure each of these. So in my office, I do measure them. And then the other thing I highly promote is avoidance of these things, and then opening up your organs of elimination. So we'll go into detail there. But mycotoxins are the toxins that are made by molds And this is most commonly, we are exposed to this in water damaged buildings. And of course, in Hawaii, it's very humid. And I think of like the back of Manoa and everything covered in mold. When I had friends living there, you open the closet and the backpacks and everything stored in there is just like covered in a layer of mold. And it's a little bit terrifying to me because now that I think about it in retrospect, those molds have the potential to create toxicity. Most people have heard of Botox, right? Women, and maybe some men too, but inject Botox, botulinum toxin into their foreheads to prevent wrinkles. And this is because the toxin that botulinum, the bacteria that botulinum makes, it makes this toxin, it causes paralysis. It's a very clear neurotoxin. We use it aesthetically for that purpose. Well, when you're living in a moldy or water damaged building or working in a moldy or water damaged building, what can happen is that those toxins are released into the air, and instead of injecting it, knowing that you're injecting a toxin, you are breathing it in, and potentially at night if it's in a bedroom, and you can start to get to levels that are, again, highly neurotoxic. And this can cause brain fog and many strange symptoms, and getting them out is paramount. Heavy metals are another big toxin that can be an issue. Mercury, which can show up in amalgams and also in fish, particularly swordfish. I would recommend everyone avoid eating swordfish. Shark, absolutely, as well. As you go higher up the food chain, mercury that's in the atmosphere, it comes from coal power plants, but it also just gets into the atmosphere. Some of it naturally, most of it from industrialization, but it gets into the atmosphere, it goes into the oceans and then into the algae. As it moves up the food chain, it gets more and more concentrated. So ahi is not great. But swordfish is even worse, and shark is even worse as you get bigger and bigger fish. So I would recommend everyone avoid swordfish and shark and eat ahi really occasionally only, and potentially have your heavy metals tested. I, of course, grew up eating tons of ahi. My mercury levels are not terrible, but I measure other people and they have very high levels. So part of that depends on how well we detoxify. And then chemical toxins. These are things like parabens, PCBs, petrochemicals, flame retardants, herbicides, pesticides. All of these things are ubiquitous. They're in the environment, and we want to avoid the ones that we can. So make conscious decisions about cleaning products, personal care products, and what we spray in our yards. And then avoid them where we can and do what we can to help our bodies get rid of them as quickly as possible. They are also can be highly neurotoxic, and they can be endocrine disruptors. They haven't been around for millennia. Our bodies don't know what to do with them. And so it can send the wrong signals, inflammatory signals, and really throw things off quite profoundly. Alcohol is another one. I recommend avoiding it for the most part, and really minimizing alcohol intake, because it's toxic, it's poisonous. So occasionally indulging, but of course not having too much. If you have a hangover, that is way too much. And if you find you have a craving for alcohol, maybe looking to other things that help to GABA balance. There are theanine and taurine and glycine, and GABA itself can all get you that same effect of that 5 o'clock Friday feeling. So talking to a doctor about how you might be able to do that with amino acids versus a beverage is best for your brain. So again, avoidance and detoxification become the name of the game here. Stopping the exposure is 75% of environmental illness. And really the most bang for your buck, of course. And I love talking to a group in Hawaii, because everybody takes their shoes off, and hopefully the doors and windows are open all the time. Indoor air quality is the lowest quality air. So it's this diffusion is the solution to pollution. So opening doors and windows, allowing that fresh air from the outside to dilute any indoor air and take any toxins out. It's the volatile organic compounds that come off of furnitures, off the paints, those collect and they become more concentrated inside. So opening everything up, at least for an hour a day, is highly recommended. And hopefully I don't have to do too much to convince all of you. You're already doing this. No plastic food or water containers. So I highly recommend drinking out of glass, ceramic, or stainless steel water bottles. And plastic and styrofoam as well, never, ever, ever hot. So don't put food and plastic in the microwave. What you end up doing, and in hot water bottles, like if a plastic water bottle gets hot, you're essentially drinking the plastic. And there are a plethora of toxic compounds in there that can be very hard on your brain, and especially the endocrine system, the hormonal system, which of course impacts the brain. Looking to get non-toxic cleaning products. And this, a lot of this isn't just for you, although I hope that helps to motivate you, but this is for the planet, for your children and grandchildren. Having non-toxic cleaning products, non-toxic personal care products, many makeups. So for the ladies here, many makeups, the lipsticks and blush especially have lead in them. In the US, we don't have to disclose what is in personal care products and in makeups. And so there's highly toxic compounds in those, and we're putting them on our skin, putting on your mouth where you can swallow it. And these things, especially if we wear them every day, can add up to something significant over time. So there's lots of EWG, the Environmental Working Group, has a way that they rate different personal care products as well as foods. They put out the Dirty Dozen and the Clean 15 list. And organic food is something, again, not just for us personally, but for community, for the planet, for everyone around us. Choosing organic when we have the option that these toxins aren't being put into the soils and into the environment or into us. Then non-toxic bedding. We spend about a third of our lives in bed, and I will encourage you to spend at least 8 hours sleeping, maybe more than that in bed. But because we spend so much time there, I think this is a place worthy of investing in a good organic mattress. We at Marama, we use the avocado mattresses. There are others, you can spend more than that. But green, good, high quality organic mattresses, as well as your sheets, your bedding and linens. I recommend, because again, it's covering your skin, and you're covered in it for hours and hours every day. And so it's a place that's worthy of the investment. And I highly encourage you to avoid pesticides and herbicides, do what you can naturally at home. And then I mentioned how toxic mold can be. So being vigilant about mold or water damage in your home and in your offices to avoid these exposures. And then how to get rid of them. So we can't avoid them all. And this can be very anxiety provoking for some people, of learning how much there is in the world that can hurt us and kill us and damage our brains. But really, our bodies are designed to deal with this. And so how do we help the system? We help by moving our skin and lymph, helping the liver, supporting the liver nutritionally, reducing the impact by reducing the exposure, supporting the kidneys and the bowels and the lungs. So some ideas here and some low-hanging fruit. If you are not having a bowel movement every day, please go talk to your doctor. This is absolutely critical. This is really, really important to good health. So at least one bowel movement daily, because if you don't, then that matter it can be reabsorbed. So your bowels don't just store your feces, but they also will reabsorb. And the work that the liver did yesterday to get rid of toxins those toxins will be reabsorbed back into the bloodstream. They can cause tissue damage. And then now your liver is having to take out yesterday's trash as well as today's. So by having that daily bowel movement, you reduce the strain on the entire system. And then adding binders and fiber, especially fiber, helps with cholesterol. It can help with blood sugar. It can help with mood. It can help with, of course, with cognitive function over time. So having plenty of fiber in your system will help with bowel movements, but also helps with gut flora. I mean, fiber is phenomenal. I highly recommend everyone make sure that they're getting plenty, because our ancestors got about 200 grams of fiber. Most Americans now will get maybe sometimes 10 or 15 grams a day. And so our bodies are designed for much, much, much more fiber than we get. You can add supplements like psyllium, acacia fiber. I like clay, charcoal, and chlorella because they tend to bind toxins very effectively. Some of the binders can be binding. So if there's constipation, definitely, again, chat with your doctor. Things like magnesium can be helpful. Vitamin C can be helpful to get bowels moving. And then with the liver, Again, eliminating things like alcohol, eating organic, but also considering some additional supplemental support like N-acetylcysteine, NAC, B vitamins, vitamin C, milk thistle, and also artichokes are great for the liver, just eating artichokes. Phosphatidylcholine, that PC stands for phosphatidylcholine, is really helpful at getting bile to flow into the gut in a smooth way, and can help, if you have had gallstones, you can consider that, talk to a doctor about that, just getting things moving and flowing efficiently. With kidneys, getting enough water is usually the issue. It's reminding ourselves to drink enough, and really half your body weight in ounces, as long as you don't have known kidney disease, if you don't have issues with plenty of water, then half your body weight in ounces is a great place to start, right? So if you weigh 150 pounds, then 75 ounces of water a day is what you want to aim for. Skin and lymph, this is fun because I can recommend a massage, but also dry skin brushing. That would be a quick, if you have questions after this and you want more support or direction, please just shoot me an email. But dry skin brushing is something you can try. Sweating is a great way to get toxins out quickly. In using, many of us spend our lives going from air-conditioned car to an air-conditioned office, maybe even an air-conditioned house, and we don't give our bodies that chance to get hot or cold and sweat. And so getting your blood flowing, of course, through exercise, but also any sort of sauna helps with mood. And also there are studies out of Finland showing that people who get in a sauna regularly have much lower rates of dementia. So it helps with cognitive function. We're getting that blood flow that's so essential to maintaining good brain health. A rebounder is a mini trampoline. Great way to be moving lymph, also to get a little bit of cardio exercise. Vibration plates also can move lymph. Chi machines are another good way to do it. You can lie down on a chi machine. It doesn't take a lot of effort. So if somebody struggles or has a reason they can't exercise, getting a chi machine is a great way to do it. Contrast hydrotherapy is jumping back and forth from like a hot tub into a cold plunge, hot tub, cold plunge. This helps, very invigorating, great for mood, and really gets juices flowing. And then the lungs, we often forget about, but this is why cops can use a breathalyzer. Right? When we take toxins in, we can often breathe them out. That's one of the ways we get rid of them. The lungs are really responsible for maintaining pH balance in the body, and that there are different types of breathwork exercises you can do that really increase your ability to detoxify using that organ. And so I like to not forget about it, although few people take me up on going to breathwork classes. Nutrients. So the nutrients, what your brain loves is ketones. And if you go Solcere, S-O-L-C-E-R-E, and maybe there will be an email after this with a link, but if you go to my website, and I could even attach the PDF. There's a ketogenic diet handout that we just made this. I'm quite proud of it. And it doesn't have recipes yet. We're working on that, but it does give you a really great starting point for how to think about getting into ketosis and some of the resources that you might need to get you there. So our brains prefer ketones over sugar. And ketosis is a metabolic state. So it's not just a diet, although the ketogenic diet is it's the same thing. I'm talking about that, but it's not so much about what you eat. It's about how you metabolize what you eat. So most of us spend our lives in glycolysis, or burning sugar for fuel versus fat for fuel. But our brains prefer to burn fat. And as we age, and especially if we've been exposed to lots of sugar over time, or if we're starting to have what we call glycotoxicity, too much sugar, or going in the direction of diabetes, insulin resistance, then our brains are not very good at burning sugar for fuel. They're not efficient at it. So ATP is the energy source, the fuel that our cells run on. And if we can't make ATP out of sugar, then you end up with a lot of sugar in the blood, but the brain not functioning. So the answer to that is just to switch the fuel source. The brain loves ketones. From an evolutionary perspective, this makes a ton of sense because our ancestors didn't have access to Skittles and Twinkies all day, every day, right? They had what was available as they were hunting and gathering. And oftentimes that didn't contain carbohydrates. And so When the ketogenic diet is a fasting mimicking state. So when our hunter-gatherer ancestors couldn't find carbohydrate-rich foods, their brains turned on, right? That's exactly what you would hope would happen if you couldn't find food. You need to be able to look for it. So what we find is that when people get into ketosis, their brains turn on. They are happier, they sleep better, they lose weight, blood pressure normalizes. It can be a little bit of a bumpy ride getting there. There is the keto flu happens often for some people, especially if they've had a more high sugar diet. So if you're going from a healthy-ish diet, like a paleo diet, a Mediterranean diet into ketosis, usually that transition is not quite as challenging. But if you're pretty toxic or you're quite addicted to carbohydrates, then that transition can be a little more challenging. But there's lots of support that you can get, and I promise it's worth it. And minerals are here. Minerals are an important thing to keep stable while you're going into ketosis. It is a detox diet, so it helps us in a few ways. It switches the fuel source in our brain, but it also helps to get rid of some of those toxins that most of us have accumulated over our lifetimes. And minerals can help with that, maintaining that mineral balance. Electrolytes, so there's lots of supplements. There's actually the one I love comes from Kona, deep sea Kona minerals, but sea salt is the best mineral source because it's perfectly, the proportions of each mineral are designed for our bodies. It's this divine design. We evolved on this planet where there was sea salt, and our bodies appreciate, rather than having lots and lots of sodium like what you get in table salt or in processed foods, the body wants a little magnesium and a little vanadium and a little silica and all of the other minerals that naturally occur in sea salt. B vitamins are another one. They play well together, and as we age, we're not as efficient at digesting and absorbing them. So sometimes supplementing makes a lot of good sense there. Same thing with antioxidants. As we age, we tend to have more oxidative stress. So antioxidants like vitamin C, many of these are available, of course, in fruits and vegetables, alpha-lipoic acid, glutathione, and then amino acids. I had mentioned GABA, glycine, taurine, theanine. These are very calming to the system. They help promote the calming neurotransmitters. Tryptophan or 5-HTP, this helps with serotonin and melatonin production. Again, these are the things that help us to calm down, to sleep at night. And then for cognitive function, we don't just want to calm down, right? We want balance in all of these. So acetylcholine, choline is in eggs, but you can also take additional supplements to help with that. And then nootropics, things like mushrooms, certain mushrooms, huperzine, there's a long list. And I think I go into a little bit of this here. Qualia Mind, some friends of mine some genius friends of mine put that formulation together, and it's there under supplements, Qualia Mind. This is a really great multi for the brain with a lot of those nootropics and a lot of those nutrients that not all of us have abundantly, but that help really, really well to help optimize cognitive function. And you can take it, I take it on days that I have a lot going on and I want to be super focused and productive. It helps to support dopamine and acetylcholine. So it's motivating and helps with mood, and then also helps with cognitive function. Omegas, omega-3 fatty acids. So this is from wild salmon. Wild Alaskan salmon is a great source for this. Sardines and anchovies are also another really good source. Some mackerel and herring can be good sources. This is the cold water fish that is so good for our brains. And you can also, of course, take supplements there. NAD and NMN, again, down at the bottom. This comes out of the work of David Sinclair, who's at Harvard. You may have seen his book. Gosh, I think I probably have it right here. He has a book called, oh, I'm going to forget. Oh no, I needed to take my qualia today. I skipped it this morning. I'll remember, and I can send that out in an email as well. But there's a great book by David Sinclair that talks about it. He's done work for decades at Harvard on yeast and Drosophila fruit flies, I believe, and several other organisms, where he looks at aging and what makes us age and how to reverse it. And NAD and NMN, resveratrol, some of the antioxidants, the analogy that he uses that I appreciate so much, and hopefully you guys are all in the age that you know what a CD or a DVD is. But if you take the genetic information, our genome, and if that's like a CD or a DVD, that genetic information as we age gets scratched in this analogy, and NAD is like the buffer. It's like taking a rag or a cloth and buffing out that CD that's been scratched so that that information is more clearly transmitted. And so as we age and we go through stressful events, whether it's physical stressors like a surgery or an infection, or even psychosocial traumas, when that kind of thing happens, when we're under a lot of stress, the way that our biochemistry works around the genome is that it's distracted, and it allows more errors to happen in that genome. And so this is what contributes to aging. You know how people go gray overnight after a stressful event. This is part of what's happening, is basically there isn't protective molecules around the DNA, and NAD basically puts those protective molecules back on the genome. So you can do NAD, it's hard to take orally, so NMN is the alternative, or you can do IV or injectable NAD. This is niacinamide adenine dinucleotide. It's a cofactor used in tens of thousands of biochemical reactions in the body, and it's a form of vitamin B3. So again, these B vitamins, so important. And then sugar can be very taxing on the body. Sugar, stress, of course, things like surgeries and car accidents and injuries and high stress events can also be very taxing. And we need extra nutrients to get through that. And then gut health, if we can't chew and then swallow and digest and assimilate nutrients, then we're never going to have enough. And so making sure that your gut is functioning, you know, if you have IBS, go see a functional medicine doctor. Lori Steele-Smith and Curtis Takimoto-Gentile, Krishana Takimoto-Gentile in Honolulu are all phenomenal doctors and could help. And I would get ahead of this because health starts in the gut, a good dentist as well, because the gut starts in the mouth. But making sure you're staying on top of oral health and gut health, because if those things beget other chronic complex illnesses. So definitely taking care of that. Aloe is phenomenal it just like it helps with a sunburn. If you've ever used aloe for a sunburn, it does the same thing to our guts. It's very, very healing and soothing. So that's an easy, quick thing to do, highly accessible. So another couple things that can dramatically impact cognitive function are traumatic brain injuries and sleep apnea. Traumatic brain injuries, even if they happened decades ago, even as a child or in your 20s, 30s, these can still be affecting you later. They can create inflammation. They can create areas of less efficient blood flow. They can start to signal to the cells around them, and they can continue to signal even decades later. So it's of course easier to treat traumatic brain injuries in the first 18 months after, immediately after. But even those that are decades old can be supported through things like B12, high-dose omegas, phosphatidylcholine, phosphatidylserine, the NAD that I was just talking about, usually by IV, and through certain exercises that chiropractic neurologists use. And so if you've had traumatic brain injuries, or if you can think back and you remember, oh, my brain has never worked quite as well as it did before I was in that accident or before whatever happened, then find a team that can support you, because I've seen miracles happen there. Sleep apnea. If you snore, you are not getting enough blood flow and oxygen to your brain at night. So get a CPAP, get an oral device, do something about it. I don't tolerate any amount of sleep apnea. So when you sometimes go to a sleep doctor, they'll say, oh, you have mild sleep apnea. Well, mild sleep apnea means a mild brain damage every night. And if anyone, I'm a brain doctor, right? It's not okay with me. And so I recommend treating aggressively, even if you have to pay out of pocket for a CPAP, or go see the dentist and get an oral device fit so that you can keep that area open at night. Some ways to know that there's potentially something going on is, one, you're told you snore. Two, you breathe through your mouth at night, not your nose. You need to breathe through your nose at night because that's how the airway stays the most patent or the most open. So you get adequate amounts of oxygen to your lungs at night, and then can get adequate amounts of oxygen to your brain at night, and all of your other organs too, of course, but we're here to talk about the brain. Daytime sleepiness, if you're waking up tired, I highly recommend that you see somebody in sleep medicine. There are now, I don't know if it was COVID or before, but the sleep studies overnight at a hospital are torture. Nobody wants to do that. Nobody sleeps well. And so they have these watches. We use WatchPat at my office, where you can go home with a watch at night and it hooks up to your phone and it transmits electronically all the information that's needed to a well-trained sleep doctor, and they can interpret it. Again, sometimes that interpretation, I think, is a little too loose. And if you're having 5 apnea events per hour, that's too many in my book. You want to treat that. And hopefully the treatment that you need is not too aggressive. And many people say, oh, I could never get used to the CPAP, or it wasn't comfortable. There's been a lot, again, the technology has improved a lot. So they have these nice little comfortable pillows. They have, instead of the continuous pressure, they have alternating pressure. So you can get the Cadillac of sleep devices. And I recommend trying a few different ones if you don't find one that works for you. And sometimes it can take a minute to get used to them, but it's worth using, and using consistently. If you travel a lot, get one that's easy to travel with. It's so, so, so important to treat sleep apnea and to breathe through your nose at night. So here are a few options. I talked about the oral appliance, and you can see here how it's really necessary for airflow to go through the nose and then through this open airway. And if you are breathing through your mouth, it's because this palate or the tongue is interfering with this open airway, or there's something going on in your sinuses. Needs to be treated so that you can get this good airflow through your nose, and then get that blood and oxygen to your brain at night. One super simple thing that many people are not aware of and can sound a little bit scary and counterintuitive at first, but very effective, is to just use mouth tape over your mouth at night. And this will, when you're unconscious and sleeping, it'll essentially force you to get into a position where you can breathe through your nose. So if on your back, your airway closes, it'll force you to go onto your sides. And then this is someone, of course, wearing a CPAP. The technology has improved since this picture was taken. There are lots of other options, although some people like these. But there's lots of options when it comes to good CPAPs and APAPs, the alternating pressure ones. So find the one that works for you if that's what you need. And weight loss that usually comes with the ketogenic diet is also helpful too. So stress. Last time I was fortunate enough to chat with you guys, we talked a bit more about this because mental health, so depression and anxiety, PTSD, this really increases our risk of dementia and cognitive decline. And not getting enough rest, not getting enough sleep, I think we can all relate to being jet lagged or not getting good sleep the night before, and our brains just don't function. Things don't click, things don't work the same way the next day. And when that's happening on a chronic basis, this is the type of thing that leads to dementia. When we sleep at night, when we're getting rest, when we meditate, when we exercise, this is how our brains detoxify, not just Roundup and like petrochemicals, but all of the things that our brain naturally makes, the hormones and the neurotransmitters that need to be processed, all of that metabolism, it requires rest. We skip it. We also, if we don't get enough sleep, and if we don't get enough sleep, we also skip the process of getting our memories basically packaged in a way so that we can retrieve them. So it's very important. Dreams, right? That dreams, that REM sleep, and then also especially that deep sleep are really, really essential to maintaining good, high quality cognitive function. So and there are studies now that show that not getting enough sleep, being sleep deprived in your 20s and 30s and 40s, puts you at risk of dementia in your 60s, 70s, and 80s. So you can start making up for it now. It's like a bank. You don't want to withdraw too much there, and you can get that savings back. So get that extra sleep. Sleep until you feel well rested. And if you're not feeling rested, despite getting 8 or 9 hours of sleep, then talk to sleep medicine about assessing you for sleep apnea. So caregivers who take care of people with dementia have 2.5 times the risk of developing dementia. And you all have stressful jobs for the most part. Hopefully you found ways to manage that and make it not too stressful over time. But high stress makes us not exercise, right? The exercise goes, we don't eat as well. Maybe we are emotional eaters and we start making bad choices. When cortisol goes up, we crave sugar, we crave that quick energy. And if that's happening day after day, or if we're a stressful job, either caring for someone with dementia or maybe being an attorney, we stay up late and work at night, not giving ourselves enough space to rest and recover and take care of our brains. So all of these things put us at risk, and my recommendation is to prioritize meditation, exercise, rest, and to understand fully the risk that we're taking when we don't. There is a meditation called Kirtan Kriya. It's a Satanama. 12 minutes once a day has proven to support and improve cognitive decline. So reverse cognitive decline, improve cognitive function. So that's an easy, quick thing to find on YouTube. It's just Kirtan, Kirtian. And again, this could maybe go out in an email, Kriya, Kirya. And there's a bunch of explanation on YouTube. There's also that it can just guide you straight through it. At Marama, at the residential care facility, we put this on every single day, and the residents do it. And it's neat and a privilege to watch the room change, the dynamics in the room, and everybody just simmer down and quiet down. And then the moods are elevated afterwards. Even if there's some tension among caregivers or the residents, everybody's in a better mood 12 minutes later. It's magic. So infections. COVID, maybe some of you know or have experienced somebody who had COVID and their cognitive function just hasn't been the same since. So this cytokine storm that everybody is aware of these days, especially when you start layering them on top of each other. So if you had toxicity, heavy metals, plus COVID, or if you had another infection plus COVID, then this cytokine storm can be magnified, amplified, and then perpetuated. And the cytokines are essentially, it's inflammation. It's the manifestation of inflammation in the system. And it tells your body to be puffed up, and it decreases blood flow. It creates distraction essentially in the system. And so COVID is one of these things that we're seeing associated with dementia, and through COVID, the isolation associated with the lockdowns, particularly in the elderly population, we've seen dementia increase. The rates of diagnosis of dementia have increased. It seems like the incidence is going up. So although it was good that, people didn't die, there is also this repercussion of being isolated that is these secondary effects of COVID. Herpes, there is good data out of Taiwan, where we see that people who are treated aggressively with antivirals, if they had recurrent herpes outbreaks, they had lower rates of dementia than those who were not treated aggressively. So if they allowed outbreaks to happen and suffered with them. So I highly recommend, if you are one of the people who suffers with recurrent herpetic outbreaks, get valcyclovir or acyclovir, whatever works for you. I'm a naturopath. I don't typically push medications, but this is a place where I think the data is compelling enough that I put all of my patients who have herpes outbreaks on either preventive or very high doses very quickly if there's any prodrome associated with HSV, because it does, and there are other studies that show that P. gingivalis, Borrelia, and herpes all trigger beta amyloid plaque production in the brain very quickly. So faster than maybe an EBV or like a monotype virus or some of these other viruses that we might come into contact with. Herpes in particular triggers that neuroinflammation very quickly. This next one, P. gingivalis, is in the mouth. And so this is my, I'll wag my finger at anybody who hasn't been to the dentist in the last few years. Now is the time to go. Regular dental cleanings. If you ever see blood when you are brushing or flossing, sometimes you can be on too many fish oils and you can back off of those and see if it goes away. But if you are seeing blood when you're brushing and flossing, go to a dentist, make sure that if there's any sort of gum disease, anything out of control, and probably start brushing and flossing more regularly, or get some tools from the dentist. Whatever's going on there, really, really important to treat abscesses. If there's an infection in the mouth, get ahead of that quickly. Borrelia is Lyme. Borrelia burgdorferi is the Lyme disease. And this also, like syphilis, it's a spirochete. Neurosyphilis, which doesn't really exist anymore because it's pretty easy to treat with antibiotics. Borrelia is a very similar bacteria that has a neuro-Lyme component that can manifest as dementia. So if Borrelia is present, if you've had tick bites, or if you have any concern about potential Lyme or someone you know does, it's something that you want to treat aggressively, especially if there's cognitive function involved. So trophic support, this is hormone replacement, essentially. So as I mentioned at the beginning, we go to undergrad and in our 18 to 22 or so, this is when those hormones are peaking. This is when it's so easy to create new skills and to memorize things and remember things and create new synapses and new connections in the brain. And we can approximate this. You don't need to have the same sex hormone levels that you did at 21, but if you can have some, so that you're getting that same signaling to make new, to create new memories, to create new connections, then you will be better. It'll be easier to do that. So Dr. Bredesen, my mentor, who wrote The End of Alzheimer's and several other books about this and really has pioneered the work in this space, he describes it like if you think of it like my brainistan, like as if your brain is a country. If you are focused on defense and you are focused on maybe attacking, so if there's an infection you need to attack, or if you need to defend yourself from a toxin, you're not able to focus on building new roads, new infrastructure. And what we want to do is switch that orientation. If you've been in that defense or fight mode, we want to switch the orientation towards building. This is memories. This is creating memories. This is creating connections. This is where it doesn't feel so overwhelming to get directions to do something new, or to go to a new place, to drive a new route, to go to a new grocery store that you don't know, or to make a new recipe. Those are the types of things we want to be able to do so that we can maintain independence for as long as possible. And part of that equation is typically going to be replacing these sex hormones. Everybody has a different kind of risk-benefit analysis to go through with their provider. Estrogen and the Women's Health Initiative study that was stopped early in the late 90s, that was because it was oral estrogens and they were not bioidentical. Same thing with progestins, non-bioidentical. When you look at data out of Finland and out of France on tens of thousands of women who have done topical estrogen and bioidentical, the benefits far outweigh the risks based on my interpretation of the literature. And I think that's becoming more and more well accepted. And particularly if you have risk of cognitive decline, osteoporosis, heart disease. When we talk about cancer, it's a little bit more nuanced. The all-cause mortality for people, so your risk of dying if you are on bioidentical hormone replacement is lower than if you are not. The exception is if you have a cancer present that is hormone receptor positive, then there is a risk of it growing faster, and then the potential higher risk of metastasis. So it's a conversation to have with your provider and make sure that that risk-benefit analysis works out in your favor, regardless of your decision in either direction. But things like vitamin D, pregnenolone, thyroid support, if you're not getting enough of that, even cortisol support if you need that, whether it's too high or too low, just getting those things balanced. No controversy really around those, and can be very, very helpful for cognitive function. So worth exploring with a provider. So the research, just so that you know I didn't make all this up, the research comes from, again, from Dr. Bredesen's group. They published a clinical trial where they recruited 30 participants. I think 25 of them finished a 9-month study and 84% of them improved. So really radical how effective this is. It's hard work. It's a lot. I've been through most of what you would do, and we didn't even talk about exercise, which is really, really important. But this is a lot. It can be a full-time job. It can certainly feel that way. But no one should be told you can't reverse cognitive decline, and no one should have to get dementia at this stage. If you don't already have it, I'm in no way blaming people who have it, because the story hasn't been clear that there are things you can do. There's a lot that you can do, and the vast majority of the time we see improvement. On the left side, the clinical trial, these participants, they had a health coach, they had an exercise coach, they had a doctor, who did all of their testing and then created very specific, very targeted, individualized plans for each of these patients. On the right side, this is another study that was published. These patients, 51% of them improved, and all they had access to was online educational information. So they had either read the book or somehow had been turned on to Dr. Bredesen's work, and then they signed up for his RECODE protocol. Some of them got on supplements, some of them didn't even do that. Some of them changed their diet, some of them didn't even do that. They did not have very much support, but still 51% of them improved. This is a description of the clinical trial, the I Think Clear clinical trial that we just collected the last data point for on Tuesday, that I'm excited to publish this summer. I wish I could share it all with you right now, but essentially the takeaway was very similar to the other clinical trial. And most of the time we are reversing dementia. We recruited patients who had more severe disease. And what we saw is that when people did it, when they engaged with the program, when they took it seriously and implemented the recommendations, they had improvements in cognitive decline. So there's no doubt in my mind that this is reversible and certainly avoidable if you don't already have symptoms. These are some fun pictures from Marama. This is the residential care facility that I created here in San Diego County, where we have 10 residents living there now, and they get to do yoga, they go on walks together, they are exercising regularly, encouraged to exercise with supervision from physical therapists and personal trainers. We've got beautiful garden beds, and we make green juices, and they're getting emotional and intellectual stimulation throughout the day. And they're connecting. One of the things that's so important to cognitive function, and what I've certainly seen this at Marama as well as in my clinical practice, is the power of community and connection, and just staying engaged. We're social beings, and it's just super, super valuable and important to stay connected and stay engaged with our fellow humans. So that is what I've got. I think a couple of questions in the chat, and I'm happy to take them. I have a half an hour or so if anyone wants to stick around. So Desmond, do you want to take over?
Yes, thank you again, Dr. Heather Sanderson. Right now we can take any questions. Just put your questions in the chat room, and then I'll read them out loud. So the first question comes from Karen Toshima. Is mediation supposed to be meditation?
Did I really put mediation in there instead of meditation? I must have known. I was talking to a bunch of attorneys today. Yes, it's supposed to be meditation.
Okay, so that was a typo. Oh, got it.
That is a typo. But mediation too, right? Is mediation less stressful than going to trial?
All right, so let's see. We got another question from Libby Tomar. What is the name of the meditation? What is the name of the meditation name again?
So Kirtan Kriya, and I did just put it in the chat to everyone, so you can Google that or put that into YouTube is probably the best place, and then it'll pop up one of the guided meditations.
Okay, and then this is from David. It says Prevagen.
Prevagen.
Yeah.
So Prevagen, yep, Prevagen is It's a supplement that you can buy at Long's at local drugstores. And if you are going to try this, it's a very specific mechanism. So what it does is, as we age, sometimes calcium can build up in the neurons and it makes them excitable. So they're sorry for the lingo, but essentially what happens is your neurons are more likely to hit an action potential, which causes them to fire. And it takes very little stimuli when you have calcium buildup in the neuron to create that signal. And so if you have them firing too often, and they basically burn through energy really quickly. And for some people, not everyone, if you get the calcium out of the neurons, you have a reduction in that mechanism that's leading to essentially you're overusing energy. And so you don't have enough. And Prevagen does that. It basically drains excess calcium from the neurons. We don't have a way to measure who has that happening and who doesn't. So Prevagen, I did use it in my clinical trial. We put everybody on Prevagen. We use the 40 milligram dose. So that's usually only available through a provider. If you get it from Long's, you probably want to take 2. Usually what they sell is a 20 milligram dose, or sometimes the 10 milligram dose. So you want to just make sure you're getting enough of it to make a difference. Usually what I have people do is try it for a month and then stop. And if you notice that your cognition goes backwards, then get back on it.
Okay. And then this one is from this question's from Jody. Do you have data on mold testing for Hawaii people who live in open air homes?
You know, I don't have great data. What I can say is that I've seen people who have mold sickness who have lived in homes in Hawaii. So just because the doors are open doesn't mean that you're not susceptible, or because the windows are open. So I still think it's maybe worth testing, especially if you have a suspicion that it could be an issue for you.
Okay. And then this question is from Wilfredo. Is it true that blueberries are good for prevention?
Yeah, great question. So prevention, I can never pick one thing. I'm a complex system scientist. And so it's not about one intervention. It's not just going to be Prevagen. It's not just going to be blueberries. It's really about a lifestyle. One thing that is great about blueberries, well, there's a few things. One, they taste delicious. And 2, they are great for antioxidants, which is part of what we talked about. And 3, they can keep you in ketosis. So a small amount of blueberries is those are one of the fruits, usually berries, your darker berries, blackberries, raspberries, a little bit of strawberries, but blueberries can keep you in ketosis. They're one of the few fruits that can, berries. And so if you're looking to get into ketosis, you can have some blueberries on that diet.
Okay. All right. And this question is from Jan. Is there an outline on how and what steps to start? You present a lot of to start. I believe that's the word. You present a lot of data. Sorry, I'm trying my best to read on this.
No stress. So the best resources are, Dr. Bredesen has some great resources. The End of Alzheimer's is what I would recommend as a starting book. And he has, again, like a lot of data, and he has a book called The First Survivors of Alzheimer's, which is his most recent book, and then also the End of Alzheimer's program. So those 3 books give you the inspiration through the End of Alzheimer's, The First Survivors are the stories of people who have reversed their dementia and how they did it. The End of Alzheimer's program is like a how-to manual, essentially, of what to do if you're struggling with cognitive decline. And even if you're not, maybe if you have people in your family or you're worried about cognitive decline, you can start doing those things right away.
Okay. And this question is from Charlene. Can we get your email or website? Your email address or website?
Throwing them in here now. So it's solcere.com, SOLCERE.com, and then it's Marama, MARAMA experience.com, and they're in the chat.
All right. I'll be closing the questions for the chat room right now, but then I'll answer the remaining questions left here. All right. This question is from David. Will MRIs show plaque calcification in the brain?
That's a good question. I don't do a lot of imaging. I'm actually interviewing a guy in the next couple of days about imaging for the brain. The reason being for me is it doesn't change my treatment plan, because although a picture can tell 1,000 words, right? Like it's really clear, and Dr. Bredesen's study showed this, that you get changes in the brain. You can grow hippocampal volume, you can grow gray matter on this protocol. And it's so compelling to be able to show people, look, here's your brain before, here's your brain after. It's actually growing. And you can also see hippocampal volume shrink as people age, regardless of whether or not they have cognitive decline. But MRIs, you can see a lot, CT scans, you can see a lot. I don't use them clinically because they just don't change how I approach the system and the protocol, because they're not telling me why someone has dementia. And that's what's of most interest to me. Plaques and calcifications in the brain, it cannot tell you something about why. I suppose it's structural, but there's so much more juicy information that's so much more actionable that I don't tend to rely on that. And there is a gentleman who I've worked with a bit. He's up at USC. His name is Rob Lufkin, and he has a way of doing an MRI of the head, non-contrast. He can see areas of trauma. He can see airway issues. And he can see sinus issues, he can see tooth infections, or he's looking for them though. And those really are most interesting, because that is what's going to set you up and cause dementia.
Okay, looks like we have another question from David. How indicative is family history of dementia, say grandparents had?
Yeah, so what you probably would want to do to understand if it is a genetic dementia versus maybe lifestyle related or toxic related for them, is to have your genetics that are associated with dementia tested. Now, we don't know everything there is to know about genetics and dementia, but ApoE status can give you a sense of whether or not you're predisposed. People with ApoE 4/4 status have a 1 in 2 chance, so a 50-50 chance of developing dementia. And of course, doing a prevention strategy hopefully puts you in the 50% that don't get it. People with a 3/4 or 2/4 status have a 1 in 3 chance, so about a 30% chance, 33% chance of developing dementia. And people who don't have any ApoE4 at all, who are a 3/3 or a 2/3, have a 9% chance of developing dementia. So that would probably be the way to get the most information about whether or not you have a genetic predisposition. There's also the amyloid precursor protein. This you would want to go to a geneticist, somebody, you can't just do this at LabCorp or at any lab draw site, but if you have a strong family history, you may want to talk to a geneticist and see if there are other things that indicate that you may get early onset dementia.
Okay, next question comes from Gil. An earlier frame regarding toxins showed organic food. Please clarify.
Yeah, so one of the ways to know if something is organic is especially the produce, is the number on the little, how they label food in the grocery store. If it starts with a 9, it means it's organic. And so organic food basically means that it's not genetically modified and it's not sprayed with herbicides and pesticides. And so there's literature in both directions, and this gets highly political, but my recommendation is that everyone eat organic food, that it's what's best for you.
Okay, we have 2 more questions in the chat box. Do you know any recommended local sleep medicine doctors and or doctors who work in bioidentical hormones in Hawaii?
Yeah, so I recommend Curtis Takimoto Gentile, and his daughter, a friend of mine, full disclosure, is Krishana Takimoto Gentile, and they are down by University. And then Lori Steele-Smith and her colleague Kristen Coles are in Waikiki on the Alamoana side, and they are naturopathic doctors, and they also are very, very good at managing bioidentical hormones, and they would know good sleep medicine doctors in Honolulu.
Okay, and final question comes from Gil. Does Medicare cover your services?
No, so not my services. I don't know about doctors talking about genteel because they are medical doctors. So I'm a naturopathic doctor, and Medicare doesn't cover us. But the doctors talking about genteel may. I don't know what their status is right now, or if they're just cash based. But certainly Medicare should cover this, because Alzheimer's is going to bankrupt Medicare if we don't do something different.
Okay, I think that is all the questions in the chat box. Thank you again, Dr. Heather Sanderson. And now I will pass the mic on to your father, Ian Sanderson, fellow board member, to do the closing remarks.
Thank you very much. Really appreciate your time. I happen to know how little time you have, and so I'm very, very grateful for your putting this together and taking the time to spend with us today. So without further ado, thank you much, and we all learned a lot.
Thanks for having me. Aloha.